What are the mechanisms of epilepsy medications? Imagine your brain as a busy city with countless electrical signals zipping back and forth. In epilepsy, some of these signals become overly active, causing seizures. Medications for epilepsy are like traffic controllers, helping to keep the electrical signals in check. They don't cure epilepsy but are essential for managing seizures over the long term. The goal is to reduce abnormal brain activity by either calming nerve cells or preventing them from firing too rapidly. Most epilepsy medications work through a few main mechanisms. One key way is by targeting ion channels, which are like gates on nerve cells that control the flow of ions such as sodium, calcium, and potassium. Sodium channel blockers, including drugs like phenytoin and carbamazepine, work by blocking sodium channels. This slows down how quickly nerve cells can fire, especially in focal or partial seizures. Calcium channel blockers like ethosuximide target specific calcium channels, which is particularly helpful for absent seizures that cause brief lapses in awareness. Another important mechanism involves enhancing the activity of gamma-aminobutyric acid, or GABA, the brain's main calming neurotransmitter. GABA helps to inhibit nerve activity, preventing overexcitation. Drugs like benzodiazepines, such as diazepam, and barbiturates like phenobarbital, increase GABA's effects by making nerve cells more responsive to it or increasing its availability. This calming effect helps prevent seizures caused by excessive brain activity. Some medications work by reducing the effects of excitatory neurotransmitters like glutamate, which can overstimulate nerve cells. Lamotrigine, for example, decreases the releases of glutamate, helping to stabilize electrical activity in the brain. This reduction in excitatory signals can be very effective in controlling seizures. There are also medications with unique or multiple mechanisms. Valproic acid is a good example because it affects sodium channels, enhances GABA activity, and may influence calcium channels. Levetiracetam and brivaracetam bind to a protein called SV2A, which is involved in releasing neurotransmitters, although scientists are still studying exactly how this prevents seizures. Topiramate and zonisamide have multiple actions, including blocking sodium channels, boosting GABA's calming effects, and reducing glutamate's excitatory influence. In long-term management, most epilepsy drugs are taken orally and absorbed into the bloodstream. They travel to the brain where they exert their effects. The body gradually clears these drugs through the liver and kidneys, so dosing schedules are designed to keep drug levels steady. Regular blood tests are often needed to monitor drug levels, especially if side effects or interactions are a concern. It's important to remember that not every medication works the same for everyone. Finding the right drug or combination often requires careful monitoring and adjustments by a healthcare professional. In summary, epilepsy medications target specific processes that control electrical activity in the brain. They work by modulating ion channels, enhancing inhibitory signals, reducing excitatory signals, or combining multiple mechanisms. The choice of medication depends on the type of seizures, the person's medical history, and how well they tolerate the drug. Effective long-term management involves regular follow-up, monitoring for side effects, and sometimes adjusting medications to achieve the best seizure control with minimal side effects. Always consult a healthcare professional for personalized treatment plans, as epilepsy management is a highly individual process based on scientific evidence and clinical experience.